Hi everybody, and welcome to this video on bowel health and bowel function. I received so many questions about bowel health when I put up those posts on social media that this may be the first in a series of videos about bowel function. And I thought that I would start with a topic that is near and dear to my own heart, and we would talk about constipation, because I really do feel like it's responsible for many of the issues that we see with bowel function, particularly as bowel function relates to bladder health, to back pain, even to menstrual dysfunction. So we're going to dive in. Just to recap what's actually happening when we're talking about bowel health. There are so many different things to consider. We want to consider what's happening from a stress level. This poor fellow lost one of his eyes. Irritable bowel syndrome particularly is recognized now as a dysfunction of the gut-brain axis. So stress can have a huge role when it comes to bowel health. Some people tend to go more towards the constipation end of the spectrum. Some people go diarrhea dominant with stress. So absolutely, it's really essential that we do talk about stress management when we're talking about bowel function. If we think about what's actually happening when we're eating, digestion starts really, I think, with the eyes and the brain. You know, we see something, we're starting to think about what we're going to eat, and those salivary juices and enzymes start coming forth. But after we've eaten, you know, food is moving down and it's coming into the stomach, and it's going to sit in the stomach for 3 to 4 hours, depending on what you've eaten. If it's a very heavily meat-based meal, then it's going to take longer for your stomach to deal with. From your stomach, it's going to move into your small intestine, which is actually super long and super important, because this is where most of the nutrient absorption is going to happen. But then, after about 6 hours or so in the small intestine, it's going to move into the large intestine. So coming from the ileum of the small intestine into the ascending colon, so over on the right hand side of the abdomen. And this is where the magic happens, really, or doesn't happen. What's going to happen here in the colon, or the large intestine, or the bowel, whatever you want to call it? This is where fluid gets reabsorbed. It's where all that good microbiome activity that we love to talk about, that's going to be happening here. Those good gut bacteria working to keep you happy and healthy. Fiber is processed going through the large intestine. Primarily, the colon is about waste removal. Hopefully, most of the nutrient absorption has happened in the small intestine, and this is about just getting the water out of the remains and processing. So it's quite liquid as we move up the ascending colon, and it can turn quite sharply here at the liver, the hepatic flexure. We've got the transverse colon, and then because all the water is getting reabsorbed as we move through the transverse colon, it takes quite a meandering turn as we move into the descending colon over on the left-hand side of the body, coming down the descending colon into the sigmoid colon, the rectum, the anus, and into the outer world. And we'll talk about the anorectal canal in a moment. What are some red flags when it comes to bowel health? I think that's a really important discussion to have as well. Blood in the stool, huge. Now, sometimes it can be due to hemorrhoids or piles, essentially varicose veins in around the anus. And as I said, we'll come back and we'll talk about that in a sec. But anytime there is blood in the stool, it needs to get checked out. It is a key marker for colorectal cancer. So don't just get fobbed off saying it's probably hemorrhoids or it's probably fissures. Get it checked out. Let's make sure, particularly if it's accompanied by another red flag, which for me would be new onset of colorectal issues after the age of 50. If there's a family history of colorectal cancer or inflammatory bowel disease or cervical cancer, those would all be big red flags for me as well, along with maybe a drop in weight, but also a drop in energy. So keep an eye out for all those things, and don't be afraid to get them checked out. They may seem like they're fairly innocuous things, but It's always easier to deal with a smaller problem than wait until it's a bigger problem. Let's talk then about constipation. What causes constipation? The two big factors when it comes to constipation are slow transit, so things are moving too slowly through your ascending, your transverse, and your descending colon, and they get stuck, they get dried out, hard, very difficult to pass. Or pelvic floor muscle dysfunction, so the exit route is blocked essentially by muscles that are not relaxing and lengthening when they should be to allow the passage to move through. What causes these problems? Pregnancy can be a driver. So we know in pregnancy, first of all, there's a passenger in here as well, taking up some valuable real estate in the center of the body. We know as well that increased levels of progesterone can be linked to relaxation of the smooth muscles of the bowel. Oftentimes in pregnancy as well, where women are taking iron supplements, and that can be quite constipating as well. So there's a couple of different options for that. There's some alternative iron supplements, things like Spa-Tone or Hemoplex, which are not as constipating. What you can try and do is take your iron supplements with some orange juice, because vitamin C helps with the absorption and it helps decrease the likelihood of it being constipating for you. Movement is really vital as well, and sometimes when you have constipation you really don't feel like moving, but it's actually one of the best things that you can do for constipation, literally getting things moving again. Your bowels don't like change of any type. They don't like it when you change your normal dietary routine. They don't like it when you travel. They love going in the same bathroom, in the same toilet, in the same house at the same time every day. And when you change with travel, and particularly with time zones, they can just get a little bit freaked out and try to hold on to everything. So routine is absolutely vital. And while that can be a driver for constipation, it's also an aspect that we can use to our advantage. So if you can train your bowel to go at a certain time every day by using little neural tags. So, you know, in neuroscience, we love to say that nerves that fire together, wire together. So for example, if you get into the habit of doing a nice gentle abdominal massage in the morning, possibly even with an essential oil, maybe something like lavender that's nice and calming, what will happen as your body and brain get used to that is that your brain will then smell the lavender and think, oh, she must be about to do her abdominal massage, let's get things moving. Because your olfactory senses are very much tied into your emotional senses and your memory base as well. So using something like a familiar smell like lavender or peppermint is another good one as well that has strong ties to digestive health, can really be helpful. And we've got other videos on doing abdominal massage for constipation, but just rubbing a drop or two of lavender in your hands like that, and just a few deep breaths, because we want to move into that nice parasympathetic rest and digest phase of the autonomic system. That can be super helpful for calming the nervous system down, bringing the focus towards getting the digestive system moving. Not enough fiber is another key factor. Your gut needs something to push back against. It likes to have a little bit of bulk going on in there. So your cooked veggies are great. I am a big fan of prunes, because not only are they a super source of fiber, they're quite stimulating for the bowel as well, but also there's some research showing that even 3 or 4 prunes a day not only will be great for your digestive health, but also really beneficial for bone health. So win-win. Sometimes people don't like the idea of prunes, so you can just call them dried plums, same thing. You can chop them up and put them in your porridge. Great. Oats are a lovely source of beta glucan, very soothing for the gut as well. So 3 or 4 prunes in your porridge in the morning, maybe with some flax seeds as well, another great source of fiber, really help bulk up that stool so you're getting that nice regular type 4 stool. How often should we go? The Rome 4 criteria say anything from 3 bowel movements a day to 3 bowel movements a week is normal, but I think we should possibly aspire to a daily bowel movement if we're eating 3 times a day. think of all that's coming in, it has to move out as well. However, if you've only ever had a bowel movement every other day forever, that's your norm, then you go with that. The idea is to be consistent with your bowel. Your bowel just loves routine. It doesn't like change at all. Not enough fiber, as we've said, is a driver for constipation, but not enough movement as well. So there's research showing that daily 20-minute walk is really effective. Gentle yoga twists have been shown to be effective, particularly in people with IBS. But we know that even slightly more strenuous activity, cardiovascular promoting activity, so a good aerobic, high intensity workout can actually change the population of the microbiome as well. So exercise is more than the individual components, but really quite beneficial for stress management as well as good bowel health. Couple of other things that just to be aware of that can also drive constipation. Ignoring the urge to go. So what happens is you get movement, hopefully, through the ascending, transverse, descending colon, then it's moving down towards the rectum, and your body is going to start sending signals up to the brain going, we'd really like to go now. And if you are consistently deferring that urge to go have a bowel movement, your body will just stop sending it. Fine, I won't tell you then. And what happens is then that stool can sit and more water gets reabsorbed back into the system, which makes it harder and more difficult to pass, which is not great if you're having to strain to have a bowel movement and you have issues with pelvic organ prolapse. So we always say that you are in charge of your bladder, and you can defer bladder urges, but when your bowel is telling you it would like to go, listen and obey. So you're in charge of your bladder, but your bowel is in charge of you. So listen and obey, and to try and get into the habit of really tuning into what your body is telling you. One other area to be aware of when we talk about constipation, there is a link between painful coccyx and constipation as well. So the coccyx is really important in women's health. Here's a rather ripe banana just to show you what I mean. So here's the sacrum, and we can imagine this is the coccyx. So you should have about 15 degrees of movement at the coccyx. And good coccygeal awareness is really important in women's pelvic health. There's a study that I love to quote from 2014, I want to say, by Stensgaard, showing that palpating coccygeal movement on the outside can be a good indicator of women correctly contracting and relaxing their pelvic floor muscles. And there's a more up-to-date study even from 2020. Ruth Marr and her colleagues showed that yes, if you palpate the coccyx moving, that's a good indication of pelvic floor muscle coordination as well. So doing things like palpating your own coccyx on the outside, so putting your hand on your lower back and just palpating down along your sacrum to the tip of your coccyx, just north of your anus, and then take a deep breath in, exhale, relax everything. Take another breath in. As you exhale, close your anus and lift everything up and in, and you should feel the coccyx moving up and forwards up towards your pubic bone. And hold it there while you count to 5 out loud, and then relax it back down, and you should feel the coccyx coming back down again. It's not a big movement, about 15 degrees in total, but just to tune into what's happening to the coccyx movement. So are you able to feel the coccyx moving while you contract the pelvic floor muscles and as you relax your pelvic floor muscles? But tenderness around the coccyx can also be a driver for constipation as well, because so many of the pelvic floor muscles are attached to the coccyx. So important that we get any pelvic pain drivers that might be inhibiting good bowel function sorted out as well. Not only for a local bowel health perspective, but also from a global hormonal health perspective as well, because we talk a lot about hormonal imbalance, whether we're talking about menstrual dysfunction or pelvic pain syndromes or endometriosis or even menopause. And we know that the liver is largely responsible for processing excess hormones, but this is actually the exit route here through the colon. A small amount goes through the bladder and out through the urine, but actually we excrete a lot of excess hormones through the bowel. So if your bowel isn't happy and healthy, and of course your liver, but if the bowel isn't emptying regularly, what can happen is a lot of those excess hormones get reabsorbed back into the system, and then they recirculate as well. So it's really, really foundational if we want to optimize menstrual function, if we want to really keep the uterus and the bladder happy and healthy. We know that with bladder overactivity, constipation is a huge driver there as well. We know that bowel health is linked to mood, it's linked to mental health across the board. It's linked to lymphatic function if you're working with cancer survivors. So it's just one of those really basic daily, underestimated, and I think underappreciated. You know, we just don't talk about this enough, but there's so much that we can do. So those are some of the drivers of constipation. So what can you actually do about it? Are you drinking enough water? And if you're constipated and you're not caffeine sensitive, a good strong mug of coffee is a great way to get things going. It's a great bowel stimulant. Lots of people find that if they miss their coffee in the morning, that they will go down that constipation headache path fairly quickly. So you can become dependent on caffeine to have a bowel movement as well, but no judgment here. But it can be a really effective strategy to get things going again. Prunes, as I've said, I'm a fan. 3 or 4 prunes on a daily basis. Shot glass of prune juice before you go to bed at night is also a good way to go. Just be careful if you're on the diabetes spectrum, because obviously if you're just drinking juice, that can be quite high in sugar. So I'm always a fan of eating the whole fruit, so you're getting that little kick of fiber as well. Move, go for a walk, do some gentle twists, stand up and just lean forwards a little bit, put your hands onto your thighs and do a standing cat-cow and start, you know, thinking about wagging your tail, getting that coccyx happy and healthy, because that's really going to help pelvic floor muscle engagement, relaxation, awareness, and coordination. Have you got good toileting technique? We've talked about that before as well. Have you got good awareness of what's happening with your pelvic floor muscles? Can you feel the difference between a close and a lift around the anus? And letting go and gently lengthening and then coming back to baseline again, all the while you're breathing as well. So we're not doing a massive bear down either. Your abdominal massage, also a great strategy as well. So if you go to my website, celebratemulieberty.com, and you go to the free resources, there's a podcast about constipation there, but there's also a little handout called Constipation Cures, basically just about everything I've ever done that's worked for constipation, and there might be some useful strategies there as well. Why, another just quick mention to why constipation matters as well is I want to talk about hemorrhoids or piles. Essentially, hemorrhoids are varicose veins in around the anorectal canal. Now, if we go up close here, you can see we've got some down here, just about on the outside, and those are what you might see if you feel something coming down and out while you're straining to have a bowel movement. They can look like a tiny little bunch of grapes, but they can be exquisitely tender. You can have internal hemorrhoids as well, but once you go above this dentate line in the anorectal canal, your rectum is only sensitive to stretch up here. Down around the anus, it is as sensitive as your mouth. It's just the other end of the tube. So it's sensitive to heat, to touch, to pain, to stretch, to any sort of nociceptive input there as well. And what's the first thing the pelvic floor muscles do when they sense pain or when they anticipate pain is they tighten up, okay? So the best way to deal with hemorrhoids is not to get them, first of all. But if you've had them, it's good stool formation. So getting your fiber in, getting your cooked veggies, your dark green leafy vegetables are your best friends here, your cooked broccoli, cauliflower, things like that. Really getting that fiber in so you've got a nice, firm, well-formed type 4 stool that's going to be easy for your body to empty out. You want to make sure you've got good skin care. So particularly for the menopausal ladies, the anal opening is really rich in estrogen receptors as well. So there can be a little bit of atrophy there. So you can talk to your GP. If there's a lot of thinning or tearing around there, sometimes a little bit of topical estrogen can work really nicely there. and then working on coordinating the coccyx and the pelvic floor muscles. Good toileting technique with the knees a little bit higher than the hips, leaning forwards, getting that coordination between breath, abdominals, and pelvic floor. Really, really helpful here as well. And then just gently patting, no vigorous rubbing afterwards. But good stool formation and good emptying technique are the keys for really successful management of hemorrhoidal pain. So hopefully some useful strategies there for you about constipation, about optimizing bowel function. Remember, 3 to 4 hours here in the stomach, maybe 6 to 8 hours here in the small intestine, but 12 to 30 hours here in the large intestine, the colon, moving through. If you want to see how long your transit times are, yes, you can absolutely go for defecography studies, or don't eat any sweet corn for about 3 weeks, and then have a serving with your evening meal, and then every day afterwards check your stool and see how long it takes to get from here to here, or actually to here. So you can do your own transit studies as well and just see how long it takes for you to move things from one end of the tube to the other. Bowel movements should not be painful. They should not be traumatic. They should be comfortable. They should be easy. They should be regular. So make sure you're putting the right stuff into your body. You're optimizing the terrain for absorption, and you're getting rid of what no longer serves you. Good life lessons there from our bowel. Hopefully that was helpful. If you have any questions, do let me know. And that free resource is over on celebratemeyouliberty.com. Talk to you soon. Bye for now.